Okay, so the next section for us to talk about is some adaptations in nervous system function. And we're going to talk about a variety of things affecting nervous system function. So one of the first things that happens, it's really sort of a very gross change that happens to the central nervous system, is you actually start to see a shrinkage in brain volume during pregnancy. And it's a progressive shrinkage in brain volume. So the brain on the A panel is preconception, a woman in her preconception phase, and the brain in the panel B is at term. Okay. And you may not be able to notice it just by comparing the two, but if you look at the ventricular spaces, the black spaces, right, they're actually larger in B compared to A, which actually is proportional to a reduction in actual brain volume. And if you look at panel C, what this is representing is actually a subtraction image between A and B. Okay? So C is a subtraction image between preconception and term brain in the same woman. And what you see is all of the black space in the ventricles and also in the perimeter of the brain just underneath the skull represents a loss in brain volume. Okay? And if you look at the brain in panel D, what this actually is a subtraction image of B, the mother's brain at term, with a brain image that's not on this page, which is a brain image taken of the same woman about 6 months after having her baby. And what you find is that all of those previously empty spaces have filled in again, right? So it means that basically at term, her brain shrunk, was smaller than it was before she got pregnant. But then by about 6 months postpartum, her brain got returned to its normal size. And what the E image is a subtraction image of the woman preconception before she got pregnant and 6 months after she had her baby. And what you notice is you basically see nothing because they're identical images. Okay? So basically, women lose brain mass during pregnancy. And this loss of brain mass, we're not sure whether it is exactly proportional to a loss in, whether it's exactly proportional to a change in mental functioning, but we do know that women tend to report lower cognitive function, reduced memory, reduced sort of mental agility during pregnancy compared to before they were pregnant. And that can change depending on a variety of factors. But one factor that could be affecting it is actually this change in brain volume. Now, this change in brain volume, this reduction of brain volume during pregnancy, may not be an actual loss of tissue, but rather a change in cell size, okay, where the brain actually just shrinks and expands. But we're not exactly sure what is going on with this brain shrinkage. But one thing that may be underlying the change in mental function, especially as self-reported by women, is a significant change in their sleep cycle during pregnancy. And the change in the sleep cycle is the direct effects of pregnancy hormone on the brain, right? And the direct either stimulatory effects or sedative effects of different pregnancy hormones. So the sleep cycle, okay, whenever anyone sleeps, whether you're pregnant or not, the sleep cycle occurs in phases. So when we first start to sleep, we move from wakefulness to phase 1, right? Which is really just this interim between consciousness and sleep. This is when you're just starting to fall asleep. Okay? And then after about 5 to 15 minutes, you move from stage 1 to stage 2. So the heart rate slows down and the brain starts doing less complicated mental activity. And then after another 15 minutes, you move from stage 2 sleep to stage 3 sleep. And stage 3 sleep and stage 4 sleep, okay, is a kind of sleep that we refer to as non-REM sleep, which is also sometimes referred to as delta sleep, or deep sleep, okay? And it's actually during non-REM sleep that the body starts to release things like growth hormone, and it starts to repair tissues, okay? Non-REM sleep, this stage 3 and 4, is also sometimes called restorative sleep. So getting enough of this 3 and 4 stage sleep is what's going to make someone feel rested and refreshed, or not rested and refreshed if they're not getting enough. Okay. And then about 90 minutes into this entire sleep cycle, you move into your REM sleep, right? Rapid eye movement. And this is where you are, this is commonly associated with dreaming. Your eye starts increasing movements, heart rate and blood pressure and temperature start to increase, okay? And you don't really stay in REM sleep for very long, maybe 15 minutes, before you either go back into a light sleep stage 1, right? You might have a brief waking in between, okay? But basically sleep involves moving through these stages 1 through 5, okay, with potentially some moments of being woken up in between, okay. So sleep quality and insomnia tend to worsen during the first trimester. So women are experiencing changes in their sleep patterns, significant changes in their sleep pattern, the quality of their sleep, the amount of their sleep, from basically early on in pregnancy. Okay. So women will start to experience poor sleep quality, greater nighttime insomnia during the first trimester. Things tend to get better during the second trimester, and then it gets worse again in the third trimester. And basically, the reason why sleep is changing so much in the first trimester is because of an intense increase in placental hormones, right? The second trimester, hormone levels tend to sort of stabilize. And then the third trimester, sleep is getting worse because on top of the presence of hormones, the baby is at its largest, and the women are starting to feel the most uncomfortable, which is going to start to cause more wakefulness and disruption of sleep. So the hormonal changes tend to have effects on both REM and non-REM sleep. Progesterone tends to have a sedative effect, increasing non-REM sleep. Estrogen and cortisol tend to decrease REM sleep. Prolactin, which is rising towards the end of pregnancy, increases both REM and non-REM sleep. Okay? And then other factors, as I mentioned briefly, other factors that cause disturbed sleep include sort of physical experiences. So uterine contractions, fetal movements, abdominal pain, urinary frequency, backaches, leg cramps, GI refluxes, right? So just all the things that make pregnancy like not a joyride, right? So in each one of these stages of sleep, so stage 1 and 2 that occur before this non-REM 3 or 4, and then this stage 5 sleep, okay? All of the things that, this moving in between these stages of sleep, there are certain factors that are going to tend to pull people pull a woman into wakeful arousal from these stages of sleep, right? So if we just look at the non-REM sleep and the REM sleep, we've got the different effects. So progesterone, prolactin, LH tend to increase non-REM sleep. Estrogen, cortisol tends to decrease REM, and prolactin tends to increase REM. Okay, so we have the hormonal effects on the different sleep cycles, and then we have these factors that tend to increase the likelihood of wakefulness out of the sleep cycle, which increased uterine contractions, fetal movements, abdominal pain, urinary frequency, backaches, leg cramps, GI reflux. Okay. So there was a large-scale study that was done several years ago to actually study objectively changes in sleep patterns. So what they basically did is they took women during different stages of their pregnancy and had them objectively observed their actual sleep time and quality, and also had the women self-report what their sleep was like in these different trimesters. So in the first trimester, women reported an increase in total sleep. An increase in total sleep because they were napping more. They reported an increase in daytime sleepiness, right? That they were just so tired. And they also reported that they had increased nocturnal insomnia. Now, what they were actually experiencing is that, in fact, they were right. They did increase their total sleep time. Then, objectively, they were experiencing less 3 and 4 non-REM sleep. Okay? So even though they were sleeping more, they were experiencing less of this restorative, restful sleep. And so that's why they tended to feel sleepy during the day, okay, and needed to nap frequently. In the second trimester, women reported an increase in total sleep time. They felt like they were sleeping more, or they tended to feel like their sleep time was normalizing, but they tended to feel like they were waking from sleep more often. Okay? And objectively, most women had normal sleep time, so they were returned to a normal amount of sleep. They continued to have less stage 3 and 4 non-REM sleep, and they continued to have a decrease. They tended to spend less time, rather, in stage 3 and 4 non-REM and REM per cycle. Okay, so they were having more cycles in a night's sleep, and because the duration of these non-REM and REM cycles were shorter. And then in the third trimester, the women were reporting, they were still reporting an increased total sleep time. Okay, kind of says something that even no matter what, women who are pregnant feel like they're sleeping too much, right? They reported increased insomnia, increased nocturnal waking, and increased daytime sleepiness. And objectively, they had actually less total sleep time. Okay? Even though they felt like they were sleeping more, they actually were sleeping less. They did have increased waking after sleep onset. They were experiencing an increase in stage 1 sleep, but they still had shorter and less 3 and 4 non-REM and less REM. Okay. So sleep is significantly altered during pregnancy, and it really depends on the status of hormones and the status of all of those physical factors that increase wakefulness. In general, the first trimester is a time where the hormone levels, progesterone and estrogen, are changing dramatically. They're increasing dramatically. And so sleep is significantly disturbed during that time because of that. The second trimester, those hormones are leveling off, and so sleep is normalizing to a certain extent. And then the third trimester, in addition to the hormones having a role in disturbing sleep, women are having the most are most likely to have physical discomforts that are waking them up. Now, the eye is not really part of the central nervous system. Actually, the retina in the back technically is part of the central nervous system. But I'm discussing it here because we actually tend to see changes in the eye during pregnancy. So we start to see something called corneal edema. So the cornea is right here. It's the outside covering of the eye. And the edema of the cornea, it's an effect of estrogen mostly, this edema. It tends to cause more blurred vision. Okay, so you start to see vision changes, and women also start to tolerate contact lenses less. Okay, so this blurred vision means that women who, let's say, have a prescription for glasses or contact lenses, they may actually need their prescription modified because their vision has actually changed. And also during pregnancy, women who tend to wear contact lenses might be more comfortable wearing glasses. We also see a reduction in intraocular pressure that happens, and that's because of the relaxing effects of progesterone, relaxin, and HCG on the muscles within surrounding the eye. Okay, so intraocular pressure tends to decrease, which can potentially ameliorate or make better any ocular conditions women might have caused by increased intraocular pressure. Sort of glaucoma-like syndromes are actually going to get better during pregnancy because of this. Women also tend to talk about having the consistency of their tears change during pregnancy. Women tend to have more, the higher oil content in their tears, and that's another reason why the contact lenses are less comfortable during pregnancy. So we have some sort of unusual changes that we see even in the eye during pregnancy.